Anemia happens when the number of healthy red blood cells in your body is too low. Red blood cells carry oxygen to all of the body's tissues, so a low red blood cell count indicates that the amount of oxygen in your blood is lower than it should be. Many of the symptoms of anemia are caused by decreased oxygen delivery to the body's vital tissues and organs. Anemia is measured according to the amount of hemoglobin, the protein within red blood cells that carries oxygen from the lungs to the body's tissues. Anemia affects more than 1.6 billion people. Trusted source around the world. Women and people with chronic diseases such as cancer have the highest risk of developing anemia. What causes anemia? Dietary iron, vitamin B12, and folate are essential for red blood cells to mature in the body. Normally, 0.8 to 1% of the body's red blood cells are replaced every day, and the average lifespan for red cells is 100 to 120 days. Any process that has a negative effect on this balance between red blood cell production and destruction can cause anemia. Causes of anemia are generally divided into those that decrease red blood cell production and those that increase red blood cell destruction. Factors that decrease red blood cell production. The things that typically decrease red blood cell production, causing anemia, include inadequate stimulation of red blood cell production by the hormone erythropoietin, which is produced by the kidneys. Inadequate dietary intake of iron, vitamin B12, or folate. Hypothyroidism. Factors that increase red blood cell destruction. On the other hand, any disorder that destroys red blood cells at a rate faster than they're made can cause anemia. This typically occurs due to hemorrhaging, which can happen because of endometriosis, accidents, gastrointestinal lesions, menstruation, childbirth, excessive uterine bleeding, surgery, cirrhosis, which involves scarring of the liver, fibrosis, scar tissue within the bone marrow, hemolysis, a rupture of red blood cells that can occur with some medications or Rh incompatibility, disorders of the liver and spleen, genetic disorders such as glucose 6-phosphate dehydrogenase, G6PD, deficiency, thalassemia, sickle cell anemia. Overall, however, iron deficiency is the most common cause of anemia. It accounts for nearly half of all anemia cases, and is a major nutritional disorder worldwide. What are the symptoms of anemia? People with anemia appear pale, and may often complain of being cold. They may also experience lightheadedness or dizziness, especially when active or standing up. Unusual cravings, such as wanting to eat ice, clay, or dirt. Trouble concentrating or tiredness. Constipation. Some types of anemia can cause inflammation of the tongue, resulting in a smooth, glossy, red, and often painful tongue. If anemia is severe, fainting may occur. Other symptoms include brittle nails, shortness of breath, chest pains. Blood oxygen levels can be so low that a person with severe anemia can have a heart attack. If you get a physical exam and you have anemia, your results may show high or low blood pressure, pale skin, jaundice, an increased heart rate, a heart murmur, enlarged lymph nodes, an enlarged spleen or liver, atrophic glossitis of tongue. People with signs or symptoms of anemia should seek medical attention, especially if fainting or chest pains occur. How is anemia diagnosed? A diagnosis of anemia begins with both your health history and your family health history, along with a physical exam. A family history of certain types of anemia such as sickle cell anemia can be helpful. A history of exposure to toxic agents in the home or workplace might point to an environmental cause. Laboratory tests are often what's used to help doctors find out the cause of the anemia. Tests to diagnose anemia include complete blood count, CBC. The CBC blood test shows the number and size of the red blood cells. It also shows if levels of other blood cells like white blood cells and platelets are normal. Serum iron levels. This blood test shows if iron deficiency is the cause of anemia. Ferritin test. This blood test analyzes iron stores. Vitamin B12 test. This blood test shows vitamin B12 levels and helps your doctor determine if they're too low. Folic acid test. This blood test reveals if serum folate levels are low. Stool test for occult blood. This test applies a chemical to a stool specimen to see if blood is present. If the test is positive, it means that blood is being lost somewhere in the gastrointestinal tract, from the mouth to the rectum. Problems like stomach ulcers, ulcerative colitis, and colon cancer can cause blood in stool. Additional tests. Based on the results of these tests, doctors may order additional tests such as an upper GI, a barium enema, chest x-rays, a CT scan of your abdomen, daily nutritional requirements and anemia. Daily requirements for vitamins and iron vary according to sex and age. Women need more iron and folate than men because of iron losses during their menstrual cycle and fetal development during pregnancy and breastfeeding. Iron. According to the National Institutes of Health trusted source, the recommended daily iron intake for adults ages 19 to 50 are as follows. For men, 8 mg. For women, 18 mg. During pregnancy, 27 mg. While breastfeeding, 9 mg. Men and women over age 50 require only 8 mg/mg of iron daily. A supplement may be needed if adequate iron levels can't be acquired through diet alone. Good sources of dietary iron include chicken and beef liver, dark turkey meat, red meats, such as beef, seafood, fortified cereals, oatmeal, lentils, beans, spinach, folate. Folate is the form of folic acid that occurs naturally in the body. Males and females over the age of 14 require 400 micrograms of dietary folate equivalents trusted source, McKee/DFE, per day. For women who are pregnant or breastfeeding, the recommended intake increases to 600 micrograms/DFE and 500 micrograms/DFE per day, respectively. Examples of foods rich in folate are beef liver, lentils, spinach, Great Northern beans, asparagus, eggs. You can also add folic acid to your diet with fortified cereals and breads. Vitamin B12. The daily adult recommendation for vitamin B12 is 2.4 McKee trusted source. Women and teens who are pregnant need 2.6 micrograms per day, and those who are breastfeeding require 2.8 micrograms daily. Beef liver and clams are two of the best sources of vitamin B12. Other good sources include fish, meat, poultry, eggs, other dairy products. Vitamin B12 is also available as a supplement for those who don't get enough from their diet alone. How to treat anemia. Treating anemia depends on what's causing it. Anemia caused by inadequate amounts of dietary iron, vitamin B12, and folate is treated with nutritional supplements. In some cases, injections of B12 are needed as it isn't absorbed properly from the digestive tract. Your doctor and nutritionist can prescribe a diet that contains the proper amounts of vitamins, minerals, and other nutrients. A proper diet can help prevent this kind of anemia from recurring. In some cases, if the anemia is severe, doctors use erythropoietin injections to increase red blood cell production in the bone marrow. If bleeding occurs or the hemoglobin level is very low, a blood transfusion may be necessary. The long-term outlook for anemia depends on the cause and the response to treatment. Anemia is very treatable, but it can be dangerous if it's left untreated. Pay attention to food labels and invest in a multivitamin to ensure that you're getting the recommended daily amount of iron. Talk to your doctor if you're experiencing any symptoms of anemia, especially if you have a family history of it. Your doctor will most likely get you started on a diet or supplement regimen to increase your iron intake. An iron deficiency may also be a sign of more serious medical conditions, so it's important to pay attention to your body. In most cases, just tweaking your diet or taking an iron supplement can solve your anemia.